So the best time to discuss the breast reconstruction options is actually almost right at the time that patients do speak with their breast oncology surgeon. It is really a team effort. Those decisions that are made on the oncology side impact what the reconstruction plan is. So it's really important for us to be able to discuss this with the patient early on. I think it's also really helpful to alleviate a lot of anxiety that patients may have looking at going through this process and be able to address all of those questions with a lot of education. So implant-based reconstruction surgery is actually a very easy surgery for patients. Most of our patients are actually outpatient. In the ideal scenario, we would have the mastectomy performed, and then immediately we have the implant placed in the post-mastectomy pocket. So the patient actually wakes up with the reconstruction, and currently our patients are on an outpatient basis, meaning that they go home the same day. In some cases, that immediate to implant scenario is not possible. Sometimes it's due to insufficient skin or maybe very thin skin that is a result of the mastectomy. So in those cases, we do use tissue expanders, and that expansion process is usually about 3 months in my practice. So within that amount of time, the patient gets to their desired volume, and then we're able to go back again on an outpatient basis and switch the tissue expander to an implant. So currently, the recovery from an implant-based reconstruction surgery is actually really easy. As we have advanced, and in my practice, I strictly perform prepectoral breast reconstruction. There's really not muscle that's used to perform the reconstruction, and therefore the patient's pain is actually really, really low. In fact, it's so low that sometimes patients tend to overdo things post-surgery. So that's actually the challenge that we have with patients, is making sure that they don't overdo their activities. So I guess in summary, I would say that this is a very overwhelming process for a lot of women. And the good news is that in plastic surgery, we have really advanced our techniques to a point where many women, if you visually look at their breast post-mastectomy reconstruction, no one would ever know they had a mastectomy. I do want women to feel encouraged that even though they have to go through this process, they do finish feeling feminine, confident, and go on with their lives. My name is Dr. Aldona Spiegel, and I'm a plastic and reconstructive surgeon.